Hello, my name is Sophie Woods. I'm a music psychotherapist in practice in New York State. And in this video, I'm going to be talking to you a little bit about what music therapy is. So the simplified definition of music therapy is that it's the clinical and evidence-based use of music to achieve non-music related goals. So this means that we're using music to achieve goals relating to mental health, physical health, overall well-being. So in order to become a music therapist, a person must attend a college or university with an approved music therapy program. So this is typically a normal 4-year bachelor's program. And once the person completes this program, they then move on to completing a 1,200-hour clinical internship. Once you've completed your clinical internship, you are eligible to take the music therapy board certification exam. And then once you pass that, you become a board certified music therapist. So an easy way to find a music therapist online, especially when you're kind of sorting through these bigger psychology search websites, is to look for that credential, MTBC, meaning Music Therapist Board Certified. So in New York State, things are a little bit different because in New York, we have the LCAT, which stands for Licensed Creative Arts Therapist. And this specific licensure by New York State law defines us as psychotherapists. So music psychotherapy falls under that umbrella of having a master's degree and being a licensed creative arts therapist. So how does one become a creative arts therapist? This involves attending a graduate program, having a master's degree in either music therapy, drama therapy, art therapy, dance movement therapy, or poetry therapy. So that's how we become a creative arts therapist. Creative arts therapists then, after completing their program, apply for a limited permit through the state in order to practice, and you must complete 1,500 supervised hours as a limited permit creative arts therapist. And once that is over, you get your license, you become a creative arts therapist in New York State. And New York State defines creative arts therapists as having psychotherapeutic training as well as being trained in specific creative arts therapy modalities. Again, this would be music, art, dance movement, drama, or poetry. So while I'm not going to get too much into music therapy and grief work today, I do want you to start thinking a little bit about the way that music functions in your life. So this might involve thinking about what it feels like when a familiar song comes on, what kind of emotions come up for you, what it feels like in your mind and body. When you are playing music with someone, perhaps, what does that feel like for you? When you're at a concert, you're experiencing live music with a bunch of other people, what is that experience like for you? Emotionally, physically, all of it. We want to think of it as this holistic experience. And as you ask yourself and answer these questions for yourself, it'll give you a little bit of insight into how you relate to music. And the way that we relate to music often gives us some information about how we relate to the world around us. And all of this is good information in figuring out if creative arts therapy, specifically music therapy, is the right path for you. Again, my name is Sophie Woods, and I look forward to talking to you a little bit more about creative arts therapy and music therapy. Thank you.